Welcome to the Environmental Justice Lab. I am your host, Dr. Leslie Joseph. Thank you so much for joining me. So we are continuing our series on sacrifice zones, and today we are still in our sub-series about Cancer Alley. And so on this episode, we are talking about the health impacts of living in Cancer Alley. Now, obviously, Cancer Alley gets its name from the reality that the cancer risks are higher in Cancer Alley than in anywhere else in the United States. But there are other health impacts that we need to talk about, health impacts that continue and persist in this part of the country, in Cancer Alley. We need to talk about those. And there has been some new research in Cancer Alley that was done last year that demonstrates a link between the polluting facilities in Cancer Alley and the cancer rates that the residents have in Cancer Alley. This link has been denied by the industries. It's been denied by the regulators. They would not say whether or not these facilities directly contribute to the cancer rates in Cancer Alley, but this research has shown that that is in fact the case. It has shown that the increased air pollution causes increases in cancer, and it has shown that the state and the regulators in Louisiana have discriminated in the way that they've permitted and allowed for these facilities to operate. And so we need to talk about all this stuff. And so on this episode, that's what we're getting into. Stay tuned. This is the Environmental Justice Lab. Welcome to the Environmental Justice Lab. I am Dr. Joseph. Thank you so much for joining me. And so we're talking about the health impacts of living in Cancer Alley. And I want to start off by letting everyone know, you probably already know this, but cancer isn't the only issue that people in Cancer Alley are dealing with from a health perspective. Obviously, Cancer Alley is meant to highlight the reality that the cancer rates are much higher there than anywhere else in the country, but there are other health impacts and health issues that we need to be made aware of when we think about what life is like in this area. So for instance, there was a survey done by the University Network for Human Rights, and they looked at the people that live around the Dinka plant. If you recall the Dinka plant, we talked about this a couple of episodes ago. The EPA is suing this plant, suing them to reduce their emissions. So they looked at the people that live around this plant, and they surveyed the children that live there, and they found that just about half of them that live in the mile radius of this facility say that they regularly experience the following: headaches, nosebleeds, or both, and more than half of the adults have headaches, dizziness, lightheadedness, and a third of the adults have chest pains, heart palpitations, wheezing, eye and skin irritation, and asthma. And so those are just basic, I'm trying to live, I'm trying to breathe, I'm trying to just function in this area, in this community, and they're experiencing this consistently from living around this plant. They also found that the asthma rates are sky high in this area. They say that children there are hospitalized for asthma at 2.5 times the rate of other parts of the state and the rest of the U.S., and that the rates of asthma-related ER visits are the highest in the state and the third highest across the nation. All that from just living in this area. And so if you can imagine, you live near this plant, you have all these emissions coming from this one facility, let alone everything else happening around you from other parts of Cancer Alley, and you're dealing with this day to day everywhere you go. Imagine trying to play a sport if you're a child living here and you have asthma at this high rate because of where you live. Imagine if you're a worker, if you're somebody who's going to and from work every day and you're trying to just make it, but you're dizzy, you're lightheaded, your chest hurts, your heart's beating strangely. This is what you're dealing with. You have nosebleeds. This is what you're dealing with from a day-to-day basis, living in this area. That's not counting the cancer. That's just daily life. It's just a problem, and it's something that we need to make sure we are fully aware of, because it's not just cancer that's an issue. It's all these other things: respiratory illnesses, heart, lung health, neurological health. All these things are problematic. And even beyond that, one of the criteria air pollutants that is really harmful is particulate matter. If you know anything about particulate matter, you know that breathing it in is very, very bad for you. And Cancer Alley is notorious for having high rates of particulate matter in the air. And so just to break it down for you, typically we regulate and evaluate two types of particulate matter. There's PM 2.5 and PM 10. So PM 2.5, the numbers represent the size of the particles. 2.5 means 2.5 micrometers in diameter is the size of the particle. Very, 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 very small. And PM10, the 10 is 10 micrometers in diameter. Still very small, but bigger than PM2.5. The issue with such small particulate matter getting into your lungs and into your system that you can't expel it. You can't breathe it out. You can't cough it up. And so if you're exposed to PM 2.5 or PM 10, we know that you'll have increased heart and lung disease. You'll have more cases of bronchitis. You'll have more asthma attacks. You'll have more restricted activity days. You can't do as much because your body is compromised by this PM 2.5 or PM 10. And we know that in infants and small children, it has really, really dire consequences for them because their bodies have not developed and they can't deal with this issue. And so they get COPD, bronchitis, asthma at an early age. It becomes a serious, serious problem. And based on what the World Health Organization and the EPA suggests, PM 2.5 is associated with the greatest proportion of adverse health effects related to air pollution in the United States and worldwide. It is responsible for more health issues than any other air pollutant. And Cancer Alley is full of PM 2.5 and PM 10 just from the operations of these facilities. And so even if you're fortunate enough to not contract cancer like so many have had in Cancer Alley, breathing in this PM 2.5 will almost certainly cause you some type of respiratory or heart issue. So you will be sick and you will have trouble breathing. You'll have trouble doing regular activities. You'll have trouble living your everyday life. And people have died from prolonged exposure to particulate matter. And so these are the kind of things that we don't talk about enough when it comes to living in these high pollution filled areas. Okay, you look at the cancer registry and you see who's getting cancer and how bad the rates are. But what about everyday life for every single person? Everyone is dealing with something. Everyone is having increased medical bills. They have to use more sick days. They're not able to function because they're overloaded with this pollution on a day in and day out basis. And it's a really big problem. And so those are some of the many health impacts of living in Cancer Alley outside of cancer, which is already a big problem. And as you might imagine, during the pandemic, the articles are saying that Cancer Alley became Coronavirus Alley because people who lived there died at rates that are much higher and disproportionate to the rest of the country. And you can imagine why. COVID-19 was a respiratory virus. They're living in an area where their respiratory system is compromised from all the air pollution. They died at much higher rates as a result. St. John the Baptist Parish in April 2020, had the highest per capita death rate from COVID in the country. And despite the fact that African Americans are only a third of Louisiana's population, they accounted for 55% of the COVID-19 deaths. So you can see that these areas with high pollution and high percentages of African Americans living there also had the highest death rates from COVID. And so now your body being compromised by the air pollution left the residents vulnerable to this pandemic, which we were all vulnerable to anyway because it was a deadly virus that was spreading. But once it entered into these areas, it was horrific. So when you think about Cancer Alley and you see the maps and you see all of the facilities, you see the long list of pollutants that come from these facilities, you think about how dangerous it could be to live there, just know that it's more than, oh, I may get cancer here because of these pollutants that are coming, these carcinogens that they're releasing. It's also that I'm definitely going to have a very compromised standard of living because of what I'm breathing in every day. My heart's not going to work the way it should. My lungs, my activity, my energy level is going to be lower. my brain function, my ability to understand what's going on and to do schoolwork and to do complicated tasks on the job is going to be compromised because I'm living in an area that is damaging my body physically, and my mind and my ability to function is not the way it should be because of what's happening here. And so those are some of the, not all of them, but some of the major health impacts that you can experience living in Cancer Alley. It can't be overstated how dangerous and how difficult it is to live in the specter of so much pollution all around you, constantly bearing down as you're trying to live your life and raise your family and be a productive citizen. It can't be overstated. It just can't. And so I wanted to make sure that as we think about Cancer Alley, we're aware that that is the reality. And so those are the health impacts outside of cancer in Cancer Alley. But as we go back to thinking about the cancer that is present in Cancer Alley, I want to bring your attention to recent research that has shown and demonstrated very well, I might add, that these polluting facilities and this increase in air pollution is a direct contributor to these cancer rates. And so by now we all know, and I will continue to remind you, that the risk of getting cancer in Cancer Alley is higher than anywhere else in the country. So in 2014, for instance, the EPA's National Air Toxic Assessment determined that the risk of Americans getting cancer from air pollution in Cancer Alley was 95% higher than other Americans across the country. And of course, we know that the average cancer rate in Cancer Alley is 50 times higher than the national average. That's astounding. You would think that that fact alone would suggest a link. You look at all the pollution, you look at all the carcinogens, you see the disparities in the rates of cancer, 50 times higher than the national, not 1 or 2 times, 50 times higher. That should say something. But of course, the industries, the regulators denied any connection. Well, there has been some new research done that has shown the link between air pollution and the higher levels of cancer for the residents in Cancer Alley. And this research was done by the Environmental Law Clinic at Tulane University in New Orleans. I appreciate the hard work. It was very well done. I have links to those studies in the description. You should definitely click on them, read through them, and look at how they methodically analyzed and addressed the ways in which air pollution and cancer are related and what is actually happening in Cancer Alley. And so the first article was titled, "Air Pollution is Linked to Higher Cancer Rates Among Black or Impoverished Communities in Louisiana." That is a great title. Straight to the point. Air pollution is linked to higher cancer rates. That is the main point of the article. And so they looked at different census tracts, and they looked at the tracts with the highest proportions of Black residents, of impoverished residents, and they found that those tracts were driving the association between air pollution and cancer incidence. And so the idea was that when you look at pollution versus cancer and how they're related, these types of census tracts, these areas, showed a direct correlation between the two, a direct link. And they say that these findings can be explained by well-established disparities that result in greater exposure and susceptibility to air toxics in Black or impoverished neighborhoods. So it's not simply that I live in a place that has higher air pollution, therefore there's higher rates of cancer. What's important to think about is these residents don't have any other recourse. These residents have no other options in terms of getting health care, and so whatever happens to them is happening because of the pollution, because of their exposure to it, because they don't have the ability or the resources to get treated, to get the right medicine, to get the right equipment to protect themselves or to move away from the pollution. And so they can see in the study that the places with the highest levels of pollution and the highest rates of poverty or the highest number of African Americans saw this direct connection. And so the analysis provides evidence of a statewide link between cancer rates and air pollution in these communities, these marginalized communities, and it suggests that air pollution is a contributing factor to Louisiana's cancer burden. So the idea is that in these types of communities, the air pollution is directly linked to these types of communities and their cancer rates. And one thing they said in the study, which was interesting, was because they found in these areas that poverty and race were so strongly correlated, basically the people who were poor were also black, they couldn't distinguish between the two factors. So it's hard to know, is it because they're black that they're seeing higher rates of cancer, or is it because they are poor and not able to get services, and that's why they're seeing high rates of cancer? They couldn't tell. One thing I can tell you, though, without knowing the research, because clearly we've seen this in other places, we know that the higher rates of air pollution is due strictly because of the race of the communities, not because of their income level. There have been several studies that have shown that race and ethnicity are the driving factors for the placement of these facilities and not income. People used to believe that, used to say, hey, we're just putting them in poor areas because the land's cheaper. Not the case. You control for everything else, you can see that race is the reason why they're all there. So even if they can't tell in their study because there happens to be a situation in Louisiana where this area is inhabited by poor African Americans, we know from other research that those facilities are there because they're African American, because they would be considered less than in the grand scheme of things in the state of Louisiana. This study concludes by saying that black communities in Louisiana, just like elsewhere in the United States, face a double disparity, where they are overburdened by pollution and they are medically underserved, so they cannot protect themselves from the impacts of the pollution. You'll see the statistics. You'll see all of the work that went into determining these links. It's very well done. And it was peer reviewed. It's gone through the process. And so it was published knowing that it was good, sound research that demonstrates this link. And so it's going to be hard to refute the reality that the increase in air pollution is directly linked to the increase in cancer in these areas throughout Cancer Alley. Something to think about when you have that conversation with your friends and they want to tell you that correlation isn't causation, and they want to try to refute the idea, the notion that you can directly point to an industry or point to in a certain circumstance and link it to a health outcome. This research begs to differ. That was the first article that talked about the link between the pollution and the cancer. The second article that I've posted on the description talks about the discrimination that occurs when these permits for these facilities are being debated and approved. And so this article was entitled Discriminatory Outcomes of Industrial Air Permitting in Louisiana. Very simple. So the big question that they were trying to answer in this research was, is the placement of these industrial facilities driven by the state's permitting practices? So they're in the black communities because they are black communities and they're being discriminatory in their permitting practices, and that's what's happening? Or is it being driven by the infrastructure that's available in those areas? And so the state has often said that these facilities end up in those areas because of the infrastructure that's available. There's existing pipelines, existing ports. There's an available workforce that's there ready to work in those facilities. And so they're placing those facilities there to ensure that they take full advantage of the infrastructure that's around. Because historically, the regulators have denied the existence of pollution disparities, and they would say that the heavy industry in these neighborhoods are driven by infrastructure only. That's what they would say. And so when you read this study, when you look through the findings, you will see that they provide conclusive evidence that communities of color are disproportionately burdened with industrial air pollution in Louisiana, and that the state and their practices is what's driving the disparity. They're deciding where these facilities go, not the infrastructure, not any other outside factors. So these researchers found that the Louisiana Department of Environmental Quality, that's the regulator in the state, permitted a pattern of industrialization where reported emissions of common pollutants are 7 to 21 times higher among industrialized communities of color compared to industrialized white communities. And what's interesting when you read this article and you go through the research, you'll see that there's a list. They do a great job in this article. They have a table where they show the predominantly white communities and the predominantly African American communities and communities of color and the different types of industries that are in the state of Louisiana, and they tally them up and they add them up at the bottom. And what's interesting about the researchers, which I love about this article, is that when you look at the numbers and the industry types and the number of facilities, you'll look at the table and you'll say, wait a minute, there are more facilities in the white communities than in the black communities. And so you might read that and say, oh, well, there is no disparities. There's no issue because they're pretty evenly split among black and white communities. And so this is when you need a good researcher to dig into the data a little bit further. If you look closer at the data, you'll see that the industries that produce the cancer-causing pollution is more heavily present in the black communities, and all of the other types of industries that don't produce that kind of pollution are in the white community. So they are making a distinction between the type of industrial facility that's found in either community by ensuring that the ones that are really harmful and dangerous and cancer-causing and asthma-inducing are found in the black communities, while the others that are less polluting and less invasive are in the white communities. And so that's a very interesting finding that I saw that I really think says a lot about the research and a lot about how we should look at these issues. So it's not, and nobody's arguing that there should not be facilities in either community, or that there's somehow an issue of so many more in this community versus so many less in the other. The question is the type of communities and the type of pollution that they're experiencing. Because you can have the same division among facilities, just make sure you have that same division among the cancer-causing industrial pollutants that harm us. Make sure that that is split evenly between the two, black and white communities as well. But that's not happening, and the research bears that out. And so this article shows that the state is driving these harmful cancer-causing industries into communities of color, and that the specific pollutants that are harmful and that cause significant health impacts are much more prevalent in these communities than in white communities. And the previous study that they had shows that there is a link between air pollution and cancer. And so you put that all together and you can see why there's a such thing as Cancer Alley to begin with, and why it's so important to think about how harmful it can be to live in this area if we don't make changes to how things are done and how permits are given out and how pollution is monitored and managed. It becomes a big issue for everybody. And so when I think about all these different things, these health impacts, these links, this research, I have a few takeaways I want to leave you with. And so the first thing I want you to do is to not let the name Cancer Alley cause you to forget that there are so many other health impacts that people living in Cancer Alley deal with from these facilities. It's not just cancer. Cancer is a horrible, awful thing to contract, and it's something that we need to really confront and think through how we deal with. But there are other things as well that people are constantly dealing with, day in and day out, and so we have to remember that. And another thing I want you to think about when you turn this off is that with this new research, there's no excuse for the state to suggest that there is no link between all this pollution and these high cancer rates. The evidence is clear, it is right in front of you. I think this research has successfully concluded once and for all that there is a direct link, and that we should understand that when we see these facilities permitted. If you bring this facility and they produce carcinogenic air pollution, you will be increasing the cancer rates in Cancer Alley as a result. You can just say that with confidence now because this research is definitive in that respect. And my last thing is, moving forward, it's apparent to me that the burden of proof will always fall on the residents to prove that they're being harmed and mistreated by the people who make these decisions, which is so crazy. So if you're a regulator, if you're charged to protect the health, well-being, and the environment of your residents, you should have to prove to them that what you're doing is not harming them. It shouldn't be the other way around where the residents are having to prove to you that it is harming them, that these facilities are compromising our health. We shouldn't have to live in a world where that's the burden that these residents have to carry. They shouldn't be asked to produce research, to employ law clinics and universities and get on the ground and get air monitors to try to demonstrate that we're being harmed by these facilities. The state and the regulators should be looking to the residents and proving to them that this is safe and that you will not see any increases in cancer or asthma or any of these kind of illnesses based on our decision making. But because that's not the case, we're going to have to live in a world where Black communities, brown communities, poor communities, marginalized communities, you're going to have to fight more and more, over and over, gathering data, doing research, citizen science, everything to show that these are real and deliberate and intentional disparities that are occurring in your communities. We're going to have to just deal with the reality that that's not going to change. Thank you to the universities that do this research. Thank you to all the community groups and the activists who are on the ground, collecting data, having meetings, pushing the discussion, trying to work to clean up what's around them. Keep suing. Keep applying pressure to the county officials and to the regulators. Look, I saw an article yesterday that the residents in St. James are suing the parish officials to stop 2 more facilities from coming to their area. Keep suing. Keep suing. Because these disparities are real, the link is clear, and the health impacts are dire, and so we have to keep fighting. We have to support people who are fighting, and we have to keep pushing and pushing and pushing for change, and keep pushing and pushing for things to be better, and for these facilities to either reduce their emissions significantly or to not be around, because people's lives are at stake. Their children's lives, their families, there's generational trauma from living in these areas. And we need to keep fighting for a better future and for a better life for people in Cancer Alley, for anybody anywhere who's dealing with these disparities, who's dealing with these issues, because it affects all of us. And so keep fighting. And we're all here with you. And thanks for listening to this episode of the Environmental Justice Lab, where we are for the people and for the planet. See you next time.